All right, good afternoon, everybody. We're going to begin our joint Nueces County, City of Corpus Christi COVID-19 press briefing. And today we'll just have two presenters. It'll be myself and then Annette Rodriguez, our Public Health Director. And today I'm just going to go over the statistics, and then Annette will talk a little bit about drive-through testing and some of the other health-related matters dealing with COVID-19. And I will cover one small item on our continued recovery from Hurricane Hanna, but I'll do that second. And so we want to thank everybody for watching, thank the news outlets that are here covering the briefing, as well as those that aren't present but maybe getting it from a live feed, to include some of the radio stations and other affiliates. So thank you for covering, and thank you to the community for watching and listening. Okay, so let's look at the first graph here. This shows the number of new cases for Nueces County, and unfortunately the number is kind of consistent to what it's been since Monday, in the 250 range or so. So today, 259 new additional cases announced for the county. That's 5 more than yesterday, and it is a little bit more than our 7-day average of 222. So 222 is the 7-day average. Today, new cases is 259. So not the best report, and 5 higher than yesterday. But as we'll hear Friday from our Texas A&M scientist team, based on the numbers so far this week, they think that the numbers may be kind of leveling off, but we need them to go down. So that's why listening to Annette and others and following those practices that we've talked about are critical. That we can't stay at a 250 number indefinitely. That's not what we want. We want the curve that I'll show you in a moment to continue to or to further go down over time. Okay, so the next chart shows our recovered cases to active, and you can see we're making a little bit of progress here. The orange slice, or the recovered part of this graph, continues to expand, meaning more people are recovering as time progresses from those couple of big weeks we had a couple of weeks ago. Those persons are beginning to recover. So today, there's 36% of all cases are persons who have recovered. So that's just under 4,000 people. And then we still have a little over 7,000 active cases, though, in the community. And that's a lot, 7,000 people recovering. That's 64% of all the cases. The chart shows 162 deaths, which is 8 more than yesterday. And we'll focus on a chart that gives more detail on the deaths in a moment. The number of hospitalized patients is dropping, which is good. It continues to drop. If we look back at the high point that's shown on this graph, which would have been Friday, July 24, where there were 430 people in the hospital. Today, there's 397. So that's about an 8% drop in persons in the hospital. So that is good. And then of those 397 in the hospital, 147 are recovering in intensive care units. And that's 5 fewer than yesterday's 152 that were in intensive care. And then this chart here shows us the deaths in Nueces County. So we're at 162 deaths today, and yesterday we had 154. So that's 8 additional deaths that we're reporting today, for a total of 162. And then this is our 7-day trending average and daily count graph, kind of overlaid on top of each other. And the red line indicates the 7-day average. And so the 7-day average number of new cases per day is 222, as I mentioned. You can see the line is beginning to kind of come down, but not super rapidly. It looks like it comes down and then plateaus a little bit, levels off, and then drops a little bit more maybe. So that's pretty decent news, but again, we want to be back over there where we were in April and May with 0s and 2s and 3s. Okay, so that's the update on the statistics for the day. More information to include our updated zip code maps and other statistics can be found on our website, our webpage that's shared between the city and the county. So we encourage you to look there if you would like some additional information. Okay, and then I do have an update on our hurricane recovery plan in terms of brush and bulky collection. And so we had told the community earlier in the week, or Sunday, Monday, that the solid waste crews, our city, was focused on getting the rights of way cleared first, and then secondly, going back to areas which is known as area number 5 and 6 in the city, where normal brush collection with the normal cycle has been set out, and collecting that. And then the third thing was doing some of the already paid for special collections. And so we're to a point now where we can do an across the city brush and bulky pickup from debris that's resulted from Hurricane Hanna. So the program will begin this coming Monday, August 3rd, in the morning, sun up. So we're asking residents, if they haven't already, I noticed in my neighborhood there's already brush set out. Set it out already. Set it out, if you haven't already, at the curbside where you would do normal brush and bulky set outs. It will take us up to 3 weeks. We're hoping we can get it done sooner than that, but it will take about up to 3 weeks to get all that brush picked up. And there'll be a kind of a method of how we'll go across the city. There's an initial plan. I don't want to say it today because it may change as we finalize it through the day today and tomorrow. But the point is, or the main thing is that everybody should put their brush out if they haven't already now. Don't wait for a notice that it's your cycle or your turn or your area's turn. Just go ahead and put it out. We should have it picked up within a 2-week, maybe 3-week period. And that's a special collection due to Hurricane Hanna. And then just to note, it won't be, we're using a contracted company to assist so we can get it done quicker. That way we can stay on our regular schedules as well. And so you'll see non-city vehicles. It's going to be a private company that's coming down the street, just so you know. And the trucks will be a little bit bigger than what we typically use in our neighborhoods. But they've helped us before during Hurricane Harvey. So it's the same company. They did a great job then. And they'll be here again starting Monday. Okay, so, the last thing on that is if you do put out 2 different items to include brush and bulky items like wood planks, fencing that may have been blown over, keep the piles separate so that we can, as a community, recycle that brush, and then we'll take the bulky stuff to the landfill. So if you have a mix of brush and bulky, keep the brush in one pile and give a little bit of distance, and then put your bulky items. That way we can turn the brush into mulch, save landfill space, and save our money ultimately. And then put things like wooden planks, fencing, if there's any roof shingles, something of those sorts, put those in a separate pile, a good distance away from the brush. Okay, and that concludes this update. We'll have more information on the brush bulky set out, but this is fresh off the planning press here, so I wanted to share it first today with the community in this forum, and then we'll be doing a media release and several other ways to communicate with the public. Okay, so with that, we're going to turn it over to Gabby for a translation in Spanish, and then we're going to have Annette Rodriguez provide us with some additional information, and then we'll be here for questions with the media. Thank you.
En las últimas 24 horas se han reportado 259 casos confirmados por el coronavirus, haciendo un total de 11.160 casos. 3.989 pacientes se han recuperado por completo, 397 personas continúan en el hospital, 147 están en la unidad de cuidados intensivos, 7.009 casos continúan aún activos. El día de hoy se reportan 8 fallecimientos, haciendo un total de 162 personas a la fecha. En cuanto a la recuperación por el huracán, las cuadrillas de limpieza y recolección de ramas van a continuar recolectando por zonas. El próximo lunes vamos a comenzar un programa de recolección para las ramas y artículos voluminosos para que se le pide que los deje sobre su banqueta para que así sean recolectados. Esta tarea nos va a tomar varias semanas. No importa qué fecha de recolección le toca en su residencia, solo le pedimos que los artículos estén separados, las ramas en una pila y los artículos voluminosos en otra pila. Ahora va a hablar la directora del Departamento de Salud, Annette Rodriguez.
Good afternoon. Annette Rodriguez, Health Director. Today we had our regular scheduled drive-through at the Health District. We had 150 people that were scheduled and 64 showed up. Of the 64, 25 were positive, giving us a positivity rate of 39%. Navigating through a pandemic is extremely challenging. It has completely changed the way we operate our daily lives. The addition of a pandemic combined with the threat of a hurricane definitely had some challenges. Even things like placing sandbags in front of doorways was much more difficult with high humidity levels and the use of a mask. This past weekend, the general public was instructed to do several things. Number one, stay at home, protect property, be prepared with food and medicine, seek higher grounds if in a flooded area, avoid flooded roads, call for help if you needed emergency. We all did our part to stay safe. We know that hurricanes are dangerous and can cause major damage to property and even destroy lives. We knew this and we took every precaution to prevent unnecessary harm to ourselves and had no loss of lives in Nueces County. The above precautions are very similar to those of COVID-19. This virus is deadly and can cause irreparable damage to our health and safety. Hurricane Hanna did not stay as long as the virus COVID-19 did. She came and went, but COVID-19 remains. Therefore, it is even more important for us not to slacken our efforts in ending the spread of this horrific virus. This virus has been here long enough. The longer it stays, the more damages it causes. We all did our part to stay safe during Hurricane Hanna's appearance, and we can all do the same to stop COVID-19 dead in its tracks. If we follow these precautions, stay at home, reduce your risk of exposure to anyone with the virus, protect yourself and others, wear a face mask when in public, and avoid people who are sick. Be prepared with food and medicine. Use alternate sources such as curbside and have medication refills called in by your physician. Stay at least 6 feet away from others. Avoid taking risk. Stay out of highly populated areas. Call for help if an emergency occurs. If your symptoms get worse, seek medical help. We got through Hurricane Hanna. We can get through this by being consistent with the public health strategies. Continue to wash your hands as often as possible. Disinfect frequently touched surfaces. Stay at home if you are sick. Do not go to work if you are sick. Wear a mask when out in public. Do not touch your eyes, nose, or mouth with unwashed hands for fear that you will infect yourself with COVID-19. I would like to extend my condolences to the family members of the 8 that died today from COVID-19. Stay strong, stay alert, and as always, stay informed. Thank you.
El día de hoy realizamos la toma de especímenes móviles a 64 personas de 150 que estaban registrados. 25 resultaron positivos, dándonos un porcentaje de 39% de casos positivos. El estar viviendo durante la pandemia y el contar con la amenaza de un huracán tuvo muchos retos, especialmente al momento de que los residentes se preparaban para la tormenta. Los residentes recibieron instrucciones para quedarse en casa, proteger su propiedad, prepararse con alimentos y medicinas, buscar terrenos más altos si estaba en áreas inundadas, evitar caminos inundados y llamar por ayuda en caso de emergencia. Todos hicimos nuestra parte para mantenernos a salvo. Sabemos que los huracanes son peligrosos y pueden causar daños importantes a la propiedad e incluso destruir vidas. Las precauciones anteriores son muy similares a las del COVID-19. Este virus es mortal y puede causar daños irreparables a nuestra salud y seguridad. El huracán Hanna no se quedó tanto tiempo como el virus COVID-19. El huracán vino y se fue, pero el coronavirus continúa, por lo que es importante no bajar la guardia y continuar evitando su propagación. Quédese en casa, protéjase y proteja a los demás usando un cubrebocas. Prepárese con alimentos y medicinas. Manténgase al menos a 6 pies de distancia de otras personas. Evite correr riesgos no estando en lugares con mucha gente. Solicite ayuda si ocurre una emergencia. Hemos superado a Hanna y podremos superar el virus si continuamos con las estrategias de salud pública. También queremos extender nuestro más sentido pésame a familiares y amigos de las personas fallecidas el día de hoy.
Okay, that concludes our briefing, and we're ready to take any questions from the media.
Yeah, we just had a few questions regarding the recovery beach efforts.
Okay.
More in regards to Bob Hall and Whitecap area, if we could try to answer those today.
Okay.
First off, what are beach crews doing to repair our beaches and get them back to normal? For instance, like moving sand around, maybe back to reform the dunes, if at all possible, and cleaning up storm debris and stuff.
Okay.
Like that.
Okay, good question. So we know that the Gulf beaches and even up here the Bay beaches were significantly impacted due to Hurricane Hanna. And so there's two entities that manage the beaches, and the county is one, and then the city does a bigger stretch all the way up to Port Aransas. So at the county's controlled beaches and maintained beaches near Bob Hall, those received significant damage, and mostly because that area was paved. It served as a parking lot. And then we know the Bob Hall Pier was significantly impacted. So the county judge and the county are closing that portion of the beach. I'm pretty sure not only to vehicles, which it already is closed, but also to pedestrian traffic because it's just totally unsafe. And so that work is underway. I know the judge told me yesterday that the county is going to be getting a structural analysis of the pier, actually two of them. I think they're doing an initial one this week and then a more exhaustive one next week. And so for right now, that area is unsafe even for pedestrians to be on the beach. Plus, there's a lot of dangerous falls with the asphalt being ripped up from the hurricane force waves and such. So that's the story on there. So that what the city's doing from about that Bob Hall Pier up to the Port Aransas area is our issue is more a sand issue. And so as the waves came in and the high tides, it caused a lot of pulling back of the dunes, the sand dunes, and additional sand probably came on shore as well. So what we have is a lot of sand that's on the beach where normally the drive surface is down here. And as that sand dries, it's going to be very difficult to drive through. Most people, probably even with a pickup truck, will end up getting stuck. So right now, the city is in the process of clearing that sand. I think we're pushing it either back towards the dunes or towards the sides, but away from what was a compacted drive surface. And because it's such a long stretch, it's the whole 20 some odd miles of coast that we manage. We can't do it in 1 week. We can't do it in a day. We can't do it in a week. So what we're going to be announcing tomorrow is a phased approach. And so we'll tell you exactly what access point you can drive onto the beach, and that section will be open. The other sections will be open too, but we're going to be under a cleaning process, and so they'll be barricaded from vehicular traffic so we can clean it, and so we get the sand out of the way so vehicles don't get stuck. So it's going to take a couple of weeks. 2 weeks, possibly, hopefully sooner than that, or it could take even longer depending. But it will be, if the order is lifted by the county judge to open the beaches as scheduled this coming Saturday, there'll be certain sections that will be ready for vehicles. Others will take time as we get that soft sand out of the way.
So just to clarify, will come out in the next day or two because we were anticipating this Saturday opening.
Yes.
If there will be specific sections that will at least be open for vehicle traffic at that time.
Right. Yeah, so to be clear, the order that was put in place by the judge and the mayor closed the beaches for a little over 2 weeks. That order expires this Saturday at 6 in the morning. And so that's one fact. The other fact is if it does expire and there's no renewal, we will have sections of the city beach open. And we'll tell you tomorrow, and we'll advertise indefinitely what roads, access roads that they are to get onto the beach with a vehicle. Some of the access points off of 361 to get onto the beach are still clogged with sand. And so it's a pretty big effort. We focus mostly, the crews are at North Beach initially, clearing that beach to 100% completion yesterday. And now we're down there. We were down there yesterday as well, but now all those crews are down there as well. And so we're clearing roads to the beach, but the beach itself, that soft surface, needs to be scraped out of the way, and then we'll get back down to that more compacted surface that we used to.
And then just lastly, I mean, obviously right now it may be too early to tell, but is there any kind of estimated rough cost of what all this might entail I know maybe we won't know more until the structural
Yeah.
analysis of Bob Hall Pier is done, but maybe just some of the moving the sand around and everything else as well.
Yeah, we don't have a cost estimate yet. We had 50 people, 10 teams out there, over 50 people in 10 different teams going across the city, looking at city facilities, the downtown marina, the beaches, and some of our buildings. And so all those numbers are being kind of tabulated now. We'll know that soon. I don't have it today.
Cool.
Yeah.
All right.
Yeah.
Well, that's all I have.
Okay, good.
Thank you.
Yes, Courtney, questions for Annette? Okay.
It was mostly just kind of an update on our testing equipment and supplies, and if we still had a backlog of people trying to get tested in the county.
We do have a backlog of people, but not very many. So we have like 300 right now that are still trying to get tested. So we've actually called 100 today, and we had 60 that were not wanting to be tested after all. So we've added an additional 200 to our list. So we're trying to get close to 300 in tomorrow, so we'll see how many actually come through, because we're trying to take care of that backlog, kind of get caught up. So we do have resources. We have like 1,700 of the VTM, which are the swabs and the test tubes. We have around 600 of the PCR, which is the cold VTM, the one that takes longer to run those tests. And then we have nothing right now from the Panther, and the Panther is the one that's a lot faster. In 4 or 5 hours, we can run 250 tests. We have nothing because the manufacturer is redoing how they're processing their kits. And so they haven't sent us anything in about a week and a half. But hopefully when they've redone this process, hopefully next week we'll start getting more of that. And we can, continue our drive-throughs. We haven't stopped yet, just so you know, but we can just continue going until the community hopefully no longer needs drive-through testing because we have everybody well. Thank you.
Okay, that concludes our briefing. I just saw a couple more posts on Facebook, but the issue of a curfew, a citywide curfew, we know there's a curfew on the beach, and that curfew is from basically sundown to sunup, so about 8:30, I think is what we have in our order, to 6 a.m. the next day. But last week we had talked about some of the listeners and followers on a curfew citywide, and we did look into that, and it would be legally tough to do because the orders from the governor are so broad to allow so many things, to include you can go to a restaurant but only 50% capacity, and a lot of things are excluded from the orders, that our legal team thought it would be too difficult to, number one, enforce, but even more so probably not even legally defensible to have one in a general setting, like a city commerce type area. So for that reason, we're not pursuing a curfew at this time. But the interventions that Annette talked about are the ones that we know work, to include staying at home. And I know a curfew would kind of force people to stay home. But the face mask, social distancing, keeping your hands clean. We're going to continue to look at things. The schools is still an issue that we're working with. And then we'll see what happens with the beaches. We'll keep folks informed on those with the orders that are set to expire Saturday. Okay, so with that concludes this press briefing. We'll be back tomorrow. Nueces County Judge Barbara Canales should be here, and Mayor Joe McComb. And then Friday, we're going to devote most of that time to Texas A&M University. The science team, led by Dr. Bird, will be here. All right, thank you, and stay safe.